The Teach-Back method is an evidence-based health literacy intervention. Teach-Back supports engagement, safety, and adherence for the person with asthma and their family. The goal of Teach-Back is to ensure that you have explained the medical information clearly. With Teach-Back, you will be able to know if the child and their family understands what you have said to them. In Teach-Back, you ask the child and the family member to explain in their own words what they need to know or do. Teach-Back can be used for all people no matter what the age. Here are some things to remember when you use the Teach-Back method. 1. Start with the most important message. 2. Limit your instructions to 2 to 4 points at a time. 3. Use plain language. For example, say lung doctor instead of saying pulmonologist. 4. Rephrase the message until the person shows clear understanding. 5. Teach-Back checks your teaching. It isn't a test for the person learning about asthma. For example, you could ask, just to be sure I was clear, how will you take your new medicine? Join me as I work with a family to demonstrate the Teach-Back method modified for a younger child. As I said on the phone, I'm going to teach Aaron how to use the quick relief and the spacer together. These are the same as the medicine he takes every day. So we're going to get started, okay? Yes. Sure. Okay. First, we're going to take the inhaler, right? We're going to take the lid
cap.
off.
The cap.
And then we're going to shake it for 5 seconds.
1, 2, 3, 4, 5.
Yes.
And put it in the spacer.
And then we're going to put it in the spacer. And we're going to check that there's no gaps, right? There's no little holes in it. Make sure it's like one piece, right?
This.
Yes. Do you want to repeat those steps to me?
Yes.
Yes. Take off the cap.
Take off the cap. Shake it for 5 seconds.
Yes.
1, 2, 3, 4, 5.
Yes.
Gonna grab the spacer.
Put it together. Right? Now it's one piece, right? Okay, next.
I can see right here.
Yeah? And let's put it together. Let's see. There you go.
And put it.
Yes, then we're going to take off the cap. Before we do that part, we're going to breathe out all the air that's inside our lungs, right? And then we're going to put the lips around it. And then that's when we're going to press the medicine. And you're going to breathe it in for 10 seconds. Then we're going to breathe it out slowly. Can you repeat those steps back to me and teach me how to do it?
Yeah. Take off the lid from the spacer and put it on your lip.
Oh, we got to make sure all the air is out our lungs, right? Then we put it on our lips. Press down and breathe in for 10 seconds. And then breathe out slowly. Yay! Now that you breathed out slowly, we're going to rinse our mouth, right? We're going to put some water in our mouth. And then we're going to wash in our mouth. And then you spit it out. Do you want to repeat those steps back to me?
Yeah. Put some water in your mouth, swish it, and spit it out.
And that's really important step to do at the very end. And do you want to know why? Because if you leave the medicine on your tongue and teeth, it could cause your mouth to get an infection. And you can get really sore. Can you tell me the last few steps again?
Yeah. Put our water in our mouth.
Wish and wash.
Wish and wash.
And spit it out. Yes. Good job. Okay, let's start over. Yeah? And you want to tell me the steps and then we can show your mommy the steps? Yeah? Okay, we're going to start with the inhaler again, right? And what do we do?
Put the inhaler on the spacer.
Yes.
Take off the lid.
Take that off. And then we're going to shake. Yay. Then we're going to put it together. Yes. I'm going to take it off. And then what are we going to do? Make sure all the air is out. Press. Hold it. 10 seconds. Slowly let it out. And what's the very last step that's also important?
Swish and swish.
And one more thing. If you need to take the medicine again, we need to wait how long? 1 minute.
1 minute.
And you can put a timer, or you can ask your mommy to put a timer. Does that sound good?
Yeah.
Yeah? Yay, good job.